The Practice Fellowship Program is an advanced professional development program with a strong applied focus. So it's about learning in practice. So we explore areas that are relevant to contemporary health promotion prevention practice, things like systems thinking. We do enabling competencies, things like leadership and cultural responsiveness. And those are the practices that will live far beyond the length of the program and cause them to be really powerful practitioners in the sector.
I wanted to become a practice fellow because it was a really exciting opportunity for the LPHUs to be able to connect in together, learn from each other, and also to be able to connect into VicHealth.
I saw it as a golden opportunity, not just for my own personal development, but also to amplify the contributions that I could make to my team, WEFU, the LPHU network, as well as the communities that we serve.
Well, we were really lucky with this pilot group. We got a really diverse bunch of fantastic people who came really ready to learn and grow and try new things and to take up the challenge. They've approached every challenge with curiosity and enthusiasm and beautiful kindness that also helped them to connect as a group.
Being able to bounce ideas off the other fellows whilst we're all still trying to learn about this space has just been invaluable. We're forming connections, understanding each other's roles and a little bit more about each other's public health units. It's priceless and it's really critical.
That safe space that the program provided, I didn't expect it, but finding that I could be myself and be in this diverse group where I could be myself and be vulnerable and ask questions, I felt that was a unique experience.
We had such rich discussions and openness and learnings from each other because we were willing to be vulnerable and be in the moment and to be trusted that that was going to land in a safe space. And it's also been quite relevant, things like the leadership program, to be able to develop those skills and sort of deconstruct the idea of leadership. And just because your title doesn't have leadership in it doesn't mean you can't lead your projects or your co-workers or other people you work with in your system.
Working with the diverse group of public health professionals opened my eyes to new ideas. I have become more aware of myself being a leader, which was not something I saw coming. Overall, this leadership program was very exciting.
The experience of fellowshipping motivated me more in that before joining the fellowship, I was in my little bubble where I worked as an officer, and I did not realize how much the profession had to offer. It gives you an opportunity to network and develop connections with people that you would not normally have access to.
Besides giving me a lot more confidence and skills, I think it's really allowed me to understand how the sector works. So not only do I understand how to apply those skills, but I also feel comfortable putting them into practice in live settings with other professionals who maybe have much more experience than me.
Highlight of my learning has been around the systems thinking, science, and putting that into practice in my everyday role. I think previous to this program, systems thinking had been very theoretical for me, and I found it really hard to grasp in terms of how I was going to practically apply it, the ways that you can practice it, the tools and the resources, and even just recognising that some of the practices I was already doing every day were systems thinking was a really big learning for me.
I think the fact that we're able to connect into VicHealth and learn from VicHealth as a major organisation has also been invaluable, because often we're in the regions, in smaller cities and towns, and we're just trying to work with our small community, and we don't have that high blue sky visioning of what the strategy and planning for Victoria is.
So I believe I have become a better health promotion practitioner because I've increased my knowledge base because of the program. I've widened my network, which has been incredibly valuable, and I've really embraced the reflective practice component of the program. I know that this will make me an even more mindful practitioner and increase the quality of the work I produce.
Reflective practice also allows you to reassess whether you've done something as well as it could have been done, you know, whether there were any gaps, whether there was anything that you needed to do better next time.
This fellowship program has actually rekindled my love for public health. It gave me the fresh tools and ideas to have a bigger impact on people's health. It has motivated me than I was ever before.
Well, I think it's giving me my confidence back in myself, especially as a leader in health promotion and being more self-aware of my own strengths and capabilities. So this program, I would say, has definitely given me back some of my health promotion mojo.
Like
Takes me back to film school.